Hello guys, welcome back to Clinically Clear. Today we'll be covering another topic, that is ICDS. Now ICDS is not a national health program, it is a scheme. It is Integrated Child Development Service Scheme. S is not for scheme, it is for service. Integrated Child Development Service Scheme. It was started in the year 1972 and almost all national health programs come under Ministry of Health and Welfare, but this comes under Ministry of Women and Child Development. That is an important point. Next, coming to the objectives of ICDS. See, child and women, it's related to child and women. So to improve the holistic health of children, overall children, that it can be social health, physical health, mental health, nutritional health, etc. And also regarding mothers, we want to have safe motherhood. We want to reduce the mortality of mothers, mortality in mothers, morbidity in mothers. We want to enable them to, we want to ensure capacity in these mothers to take care of their children's needs and give them a good life. So these are the main objectives of ICDS. Coming to the organization, at the national level, you have the secretary to the Ministry of Women and Child Development. At the state level, you have the director of health services. At the district level, you have the district health officer. These ones are not that important, but the most important is from the block level. See, in most national health programs, the administrative unit is the district level, but in ICDS the administrative unit is at the block level, which oversees a population of about 100,000. And at the block level, who is in charge? It is the CDPO, the Child Development Project Officer. So the CDPO at the block level manages, as the administrative unit, oversees a population of about 100,000. Then we have the sector level. At sector level, at a population of about, oversees the population of about 20 to 25,000 people. Here you have the Anganwadi supervisor. The Anganwadi supervises the Anganwadi workers under her area. So about 20 to 25 Anganwadi workers. See, population of about 25,000. 20 to 25 Anganwadi workers. So approximately at the village level, where the Anganwadi is the organizing unit, the population is about 800 to 1000, as 1000 per Anganwadi. So if you take 20 to 25 Anganwadi, you get 20 to 25,000. The Anganwadi is the heart of ICDS. Everything related to ICDS, the core of ICDS is the Anganwadi and the Anganwadi worker. The Anganwadi worker, she does everything. She is the one who provides the ICDS services, the benefits of ICDS to the population. She is the grass link. She is the grassroots link between healthcare service and the community. That is the most important point about Anganwadi worker. What are all the criteria for an Anganwadi worker? She should be a woman who has studied up to 10th standard, usually from their local community. She gets trained in the PHC for about 4 months regarding healthcare, nutrition, immunization, how to maintain records, record keeping, etc. She has to submit a monthly report to her supervisor, the Anganwadi supervisor, as well as the CDPO. And it is a part-time job. Remember, Anganwadi is not a full-time job. The Anganwadi worker can have another job, because this is a very low-paying job. It has only about 1,500 rupees stipend. But very, very important, because it is a grassroots link between community and healthcare at the village level. If it is even more if it is an even more remote area, like such as highly rural areas or tribal areas, then you can also have mini Anganwadis, which is responsible for a population of only about 150 to 300 people. So remember, the most important, the nucleus of ICDS is the Anganwadi and the Anganwadi worker. So next, coming to the beneficiaries, who all are eligible to receive the schemes, the services under the ICDS scheme. So you have, first of all, it is Integrated Child Development Service, right? So you have the child age from 0 to 6 years. It comes under Ministry of Women and Child Development. So the women are pregnant and lactating mothers. You also have adolescent young girls from 11 to 19 years old, and the women of reproductive age group, that is from 15 to 45 years old. So child, pregnant and lactating mother, adolescent girls, as well as women of the reproductive age group. Now the services of ICDS is nothing but the services of an Anganwadi and the functions of an Anganwadi, the functions of an Anganwadi worker. All this are the same. It can be asked as a separate question. Services provided by an Anganwadi worker, or the activities of an Anganwadi center, or services under the ICDS scheme. First of all, we have the supplementary nutrition. Now, this is prepared by the Anganwadi worker. Now, what she prepares can differ from one Anganwadi to another based on location, availability, budget, the seasonal food available, etc. And this supplementary nutrition is given for 300 days in a year. 65 days vacation off. There is no supplementary nutrition. Who can receive this supplementary nutrition? A child can receive of 0 to 6 years. A mother, pregnant and lactating mother, pregnant and nursing mothers can receive it, as well as a malnourished child can receive it. What do they receive? Basically, a child receives 500 calories per day, mother 600 calories, and malnourished child 800 calories. Whereas if you look at protein, 12 to 15 grams of protein for a child, 15 to 20 grams for mothers, as well as 20 to 25 grams for malnourished child. So how much does this cost to the program? How much is the cost for each of these supplementary nutritious meals? So it is 8 rupees per day for a child, 9.5 rupees per day for a mother, and 12.5 rupees for a malnourished child. Now, with special focus to malnourishment, there was a recently released scheme known as Sneha Shivir. According to the Sneha Shivir, first degree malnourishment, you should just give nutritional and health education to the mother, telling the mother to feed more nutritious food to the child, to feed the child regularly, and to bring the weight up and to bring the height up. If it is second degree and third degree malnutrition, then you will start giving the supplementary nutrition. As I told, malnourished child is eligible to receive supplementary nutrition under ICDS. Fourth degree malnourishment is where it becomes very severe. You have to refer the child to hospitalization. So Sneha Shivir is a part of ICDS with special emphasis on malnourishment in children. Next, coming to nutritional and health education. So you'll educate the pregnant and lactating mothers. You'll educate the women of reproductive age groups in the community by the Anganwadi workers organizing workshops and courses to build awareness, saying the importance of breastfeeding, the importance of feeding nutritious food, etc. Then immunization service. Basically, under the national immunization schedule, whatever vaccines are there, it can be given to a child from 0 to 6 years, and TD vaccine is given for pregnant females of 2 doses or 1 dose, 1 booster dose if the previous pregnancy was within 3 years. Then you'll give non-formal education. Now, Anganwadi workers, they provide non-formal education mostly to preschool children of about 3 to 6 years old. Now, because it is non-formal, there is no certificate, there is no curriculum, nothing. Basically, just through toys, through games, through songs, through play, we help the children to develop desirable attitudes, to develop behavior, and to prepare the children for school in the future. This reduces the dropout rates of children from schools. So this is about non-formal education. Then very, very important, an Anganwadi worker must do growth monitoring of children. Growth monitoring by recording the height, weight, etc., and plotting them on ICDS growth charts. By this, we can monitor the growth of the children. And for babies, to weigh the babies, Anganwadi workers use something known as sorter scale. The sorter scale is basically, you can hang it from anywhere. It has a seat for to place the baby, and it has precision of up to 100 grams. So this is how the Anganwadi workers weighs the infant, and then uses the weight and the height to plot on ICDS growth chart to monitor the growth. Then, very, very important, one of the important beneficiaries of ICDS scheme was the adolescent girl. So the AG scheme, the adolescent girl scheme under ICDS, is also known as Kishori Shakti Yojana. Here, the objective is to improve the physical and nutritional health of the adolescent girls in the community. There are various strategies. There is girl to girls approach, where we conduct workshops, bring multiple girls together, adolescent girls who interact with each other and build awareness regarding nutrition and health. That is girl to girl approach. Then in communities, there are something known as Balika Mandals. What is Balika Mandals? Basically, these are leadership groups comprised of adolescent young girls of the community. So they conduct various activities, etc. So these are leadership groups in the community. Then there are certain state-wise schemes for the development of adolescent girls known as Sabla schemes. There are various individual programs and schemes that come under Sabla schemes. Example, you have the WBNP, that is wheat based nutrition program, or the public distribution system, where we distribute wheat based nutrition to increase the the nutritional, to improve the nutritional health of the adolescent girl. Then there is, to build the skill of adolescent girls, we have national skill development programs. Then to build awareness regarding reproductive tract infections, sexually transmitted disease, and for their treatment, we have something known as ARSH, adolescent reproductive and sexual health clinics, or AFHC, that is adolescent friendly health clinics. So these are certain other things. Then you also have, under the Anemia Mukt Bharat scheme, we give iron and folic acid supplementation to adolescent girls to prevent anemia. Anemia is very, very common among adolescent young girls. So we give iron and folic acid supplementation under Anemia Mukt Bharat scheme. So these are all the strategies under the Kishori Shakti Yojana, which is the AG scheme or the adolescent girl scheme. Next, coming to what are the benefits for the Anganwadi worker? You get something known as Anganwadi Karyakarti Bhima Yojana. Anganwadi Karyakarti Bhima Yojana is basically a government sponsored health insurance scheme to the Anganwadi workers. And I told you, right, the Anganwadi workers are trained in the PHC for 4 to 6 months to teach them about all the components of ICDS, what are the services they have to do. This training is known as Udisha training, the training that the Anganwadi workers receive. So these are all the various components regarding the ICDS. A bit of a long video, but hope you guys enjoyed it. Thank you for watching.